My area of research is mainly focused on ocular drug delivery, so delivering drugs to the eye. And my research team consists of 5 PhD students and 2 postdocs, all working together to come up with new emerging technologies for treating the diseases of the eye. So what we do here at Queen's in School of Pharmacy is we develop novel long-acting formulations. We try to develop, we're working on developing minimally invasive microneedles for ocular drug delivery. We're trying to develop sustained release microparticles, injectable gels, so many different formulations, all aiming to improve the drug delivery to treat the different eye diseases. For example, one of the most common problem with people with old age is loss of vision. They tend to lose their vision over time, for which they need to get injections in the eye every 4 to 6 weeks, which is nearly monthly injections for the rest of their life, which is very painful. And not only that, it's quite expensive to treat the diseases as such of AMD, age-related macular degeneration. So the patients have to go through the painful process of injections every month, and they need to be treated with supplementary medications because injections in the eye causes other problems such as rupture of the eye tissue. There's a chances that the bacterial infection causes. So many other problems creates. Even the pressure of the eye goes up. So there are a lot of problems which due to injections, due to which the patients has to take additional medications throughout their life. To overcome this, Queen's at School of Pharmacy collaborated with Tyndall in Cork, and with the help of NAP funding, we started investigating new minimally invasive microneedles, which are very small in structure, as you can see on the screen here, at a very small structure ranging from 200 to 500 micrometer in height. They are so small that the patient cannot see in the first place, and they are small enough to penetrate the tissues of the eye where the drug can be delivered at the right region within the eye, and therefore the problems associated with longer injections, hypodermic injections, are significantly reduced. So this is one of the benefits of using microneedles based ocular drug delivery for the patients. Here is a conventional hypodermic needle. If you see this needle, the doctors normally load the drug in these needles and inject this into the eye. For example, this is a cork ball. If I show you an example of this, the needle with the drug is injected straight into the eye, the white portion of the eye, and then deliver the drug inside the eye. That causes a quite considerable damage to the eye because the needles are considerably big, as you can see. They're really large. And that's one of the problems with having these injections poked into the eye on a regular basis every 4 to 6 weeks. Therefore, to overcome the problem, so this is one of the major challenges where the patients are constantly facing. A lot of patients fear from getting these injections into the eye. And if they do not get the injections on time, the eyesight will only deteriorate. And therefore, to overcome this one of the significant challenges, we try to develop the microneedles. The other problem with injecting these needles in the eye is that the retina in the eye can detach from the eye. The pressure in the eye can go very high, and that's the reason why they need additional medications to overcome these supplementary problems which is caused because of these injections going straight into the eye. So those are the challenges with the hypodermic needle. So to resolve this issue, we came up with a solution which is minimally invasive microneedles, as you can see here. These needles, you hardly can see the needles here, which is one of the most greatest advantage with using the microneedles, because they do not create the fear, the phobia among the patients of big size needles going into the eye, but they do deliver the same amount of drug as the hypodermic needle do. So if you see this patch here, it has around 4 needles, which can be applied to the eye just by very minimally invasive way, and that allows the drug to be delivered into the eye straightforward, and therefore the damage to the eye will be very, very less, and it can be administered on a regular basis as we do with the conventional needles. So this will overcome with this number of problems which are currently being faced. To use the hypodermic needles, you need to have a very specialized training, or only ophthalmologists or retinal specialists can do those injections. Other personals like nurses, they cannot do those injections. But if we have a minimally invasive device like that, it may be even possible that the patient can do an injection by themselves because you barely see the needles on these patches. So these are much more minimally invasive and will overcome all the other problems which are seen with the conventional needles. So that is the greatest advantage, and we are working to develop such a minimally invasive device which could be applied worldwide, which would replace the current hypodermic needle. So considering the overall benefits of this project between School of Pharmacy and Tyndall, what we see is using a hypodermic needle, which is a single needle, such a long needle, compared to a very small needle which is hardly can be seen, but it is as effective as this one. This would have significant benefits for both the patients and for the doctors. What we would like to do is in future we want to further refine this one and develop further so that it is ready for application into the eye for human use. I would like to conclude this and would like to thank NAP for their funding, without which this wouldn't have been possible, and also for Connor from Tyndall, who was the engineer behind designing these devices. I would also like to thank School of Pharmacy for co-funding the project, and we look forward to develop this one so that both the patients and the doctors will derive benefits from these new devices.
At Tyndall, my team is focused on the development of microneedle-based devices for personal drug and vaccine delivery, sensing and diagnostics. Microneedle arrays are based on the construction of very, very short, very, very sharp silicon-based structures that look like conventional needles but act very differently. Microneedles are short, sharp, and therefore they're painless to users because they don't stimulate the underlying nerve endings in stratum corneum. And here, our aim is to replace conventional needle and syringe-based delivery with painless microneedle devices. These microneedle devices are made right here in our clean room at Tyndall, which is one of the most advanced facilities of its kind in Europe. We're delighted to be working with Dr. Raj Singh in Queen's University of Belfast to develop microneedle-based devices for drug delivery to the eyeball. And this is obviously a very challenging application area because of the geometry, shape and size of the eyeball. And at Tyndall we developed these miniaturized drug delivery platforms consisting of arrays of microneedles bonded to a Pyrex fluidic reservoir and interfaced to this very, very thin capillary tubing through which the drug is delivered and then injected via the microneedles into the eyeball. As part of NAP435, we delivered a range of these drug delivery platforms to Queen's University Belfast. And this particular device consists of a silicon wafer with 4 silicon microneedles mounted on the top. Each of these microneedles is just 500 microns tall and has a tip sharpness below 100 nanometers. There is a 50 micron capillary tube through each microneedle, and at the back of the array we've bonded a Pyrex reservoir wafer. And between the silicon microneedle array and the Pyrex reservoir wafer, we've affixed this very, very thin capillary tubing through which the drug is delivered. And this capillary tubing has got an inner diameter of just 100 microns, but nevertheless that allows us to deliver microliter volumes to the eyeball. We're also working with a wide range of academic and industrial partners around the globe to merge these drug delivery technologies with sensing and diagnostic platforms to create the multifunctional and wearable smart patch of the future. These smart patches will be capable of sensing the physiological status of the body and delivering appropriate therapeutic agents where needed.